Yeah, just a quick review of the Bracoo knee support brace. Um, so this brace is made specifically for people that have knee pain or they're having a knee problem. So the idea here is that you put on this brace and it supports the joint and the surrounding soft tissues. It restricts the motion a little bit in the joint. So that way the knee has a chance to rest, recover, and it won't get so stressed out as you do things. So a few points about this particular brace. It does have this patellar stabilizing ring around it. So if you do have trouble, like you say you've had some patellar kneecap dislocations or something, or you have some instability, that's got this ring in there to help keep everything in place. It does have 3 straps, which I really like, because I always think, more straps are maybe more of a pain in the butt to use, but however, I say that's more customizable, because you can get this thing tight and loose in certain areas that's more comfortable for you. So I always think that's a good thing. The last thing about this one is it is hand wash only, so you can't really take it off and throw it in the washer, so just be aware of that. So other things, what else can you do if you're having a lot of knee trouble? I'll give you a few ideas. Bulletproof your knee is where I'm getting this stuff from. First thing is strengthening, and if you're not a big exerciser, there's one muscle that stands out is your quadriceps muscle, and that's a big stabilizer of your knee. It's a big muscle on the top of your knee. And honestly, what this whole chapter honestly is dedicated to knee problems people have, and the research showing that if you have a problem with this, you probably have a problem with your quadriceps. And it's basically just about every knee problem. So look, knee swelling in the quadriceps, research showing that if you have a lot of chronic swelling, you have weakness or your quadriceps is probably smaller than normal. Knee injuries in the quadriceps, if you had a knee injury. Ligament problems such as the anterior cruciate ligament or ACL, posterior cruciate ligament, PCL, medial collateral ligament. So people with, in other words, people that have problems with the medial collateral ligament, they tore it or something. When investigators get looking at this, the strength of your quadriceps, they find there's problems. Just knee pain in general, knee arthritis is a big one. If you have knee arthritis, there's a good chance that you have quadriceps weakness. Actually, studies showing that if you strengthen your quadriceps, it actually prevents future progression of knee arthritis. That's interesting. But it doesn't take long to do that. So make sure you do a good quad strengthening exercise. Fine-tune control over your knee. This would be like your hip muscles. There's a hip muscle, in particular your hip abductors. And basically they help stabilize the hip. Actually, a lot of knee problems are caused by weakness up at the hip because, weakness up there does influence what goes down on your knee. So for instance, let's say iliotibial band syndrome. When they look at people that have ITB, they basically find that they have weakness in their hip abductors. And likewise, there's actually randomized controlled trials showing that if you strengthen your hip abductors, iliotibial band syndrome goes away. So it's a real thing. Other thing, of course, is like flexibility. You want to make sure that you stretch out your knee. Interestingly enough, though, you think your knee just bends and straightens, and that's all it does. Actually, and they got this nifty little test in here. If I can find it. About the last 15 degrees of extension, that's straightening your knee actually rotates. So you actually have an accessory motion of rotation that you have to have. So this will show you how to get that back. Finally, one last thing you can consider doing, increasing knee dynamic stability. So here we're talking about your proprioception. So if I suddenly turn the lights out now, you could tell without looking whether your knee is bent or straight. That's because your position sensor, your proprioception. So they're finding that a lot of times when people have chronic knee problems, they actually have decreased proprioception. So that's something that you can work on as well, just like with one little exercise. But yeah, lots of other stuff you can do. But hey, nothing's as quick as slapping on a brace. Usually gives people some pretty quick relief. So yeah, it's a good brace. Check it out.